Have you ever felt tired all the time and having aches and pains all over your body and you've been suffering for many years? You've gone for many doctors, your file is very thick, but everyone says all investigations are normal, your blood tests are normal, your MRI is normal, but still you suffer from pain. I know what you feel basically, and this could be fibromyalgia. Hi, my name is Dr. Roshan Adappa. I'm a pain consultant here at Alleviate Pain Management, and today I'm here to talk about fibromyalgia. It is a chronic pain condition associated with widespread musculoskeletal pain, aches, stiffnesses, soft tissue tenderness, and also associated with central nervous system issues like fatigue, feeling tired all the time, difficulty in concentrating, and feeling anxious, depression, etc. Like I said, fibromyalgia, it is a chronic, widespread musculoskeletal pain. So what are the common sites of pain? You'll be experiencing pain across all these regions of the body. Now do remember, these pains could be one day in your neck, but maybe another day it could be in your arms, and your third day the pain could also go in the back. Or you can have pain across all three areas. There's no fixed pattern to fibromyalgia. But what are the common areas where you're going to feel stiffness, aches, and severe tender points? Usually it will be the neck, your arms and shoulders, your chest, your upper back, lower back, across both your lower legs, and even sometimes the abdomen. So that is the musculoskeletal bit. But along with this, you're also going to be experiencing difficulty in sleeping, and your sleep quality will be very poor. Even if you have a good night's sleep, even when you wake up, you're going to feel tired throughout the day. Many people also complain of chronic headaches and migraines. Along with this, sometimes patients can have bowel instability, they can have irritable bowel syndrome, and there are many other conditions associated with fibromyalgia also. Like patients who have irritable bowel syndrome, like I said, or any rheumatological condition can also have fibromyalgia. Well, a lot of research is still going on, and it's still a very complex condition, but the WHO and the IASP has sort of said, it could be caused due to the following mechanisms. Genetics do play a big part. If your family, you have a history of people around you who are complaining of aches and pains, and you've gone to the doctors and everything is normal, that could be fibromyalgia, and then that has a genetic predisposition. Second one is there's always an inciting event. Almost always an inciting event. That is, you had a traumatic event. It could be emotional distress, you lost someone you loved, severe periods of anxiety, or a big trauma itself, post-accident, etc. Once that big traumatic event happens, even after your tissue or your body heals, you'll be continuing to experience aches and pains throughout the body, and investigations have all shown everything to be normal. So there's usually sometimes an inciting event. If there's no inciting event, the other causes could be your own immune system sometimes. Your immune system, your antibodies could be targeting your own tissues, of your muscles, of your brain, etc., making you feel more sensitive to pain. Your hormones and endocrine system also play a big part. Research has shown your pituitary, your adrenal glands, etc., also play a big part. There's some dysfunction of the adrenal and pituitary axis which causes the pain. Some of the most common, what we believe is actually causing fibromyalgia, is also your pain pathways. All of us have a pain pathway, but what happens in fibromyalgia patients, the pain pathway becomes very, very sensitive. So what happens is any signal which is going towards the brain produces the pain, but in fibromyalgia patients, because of the changes in the brain, they feel this pain more. They're able to perceive more signals, etc. So your brain becomes very, very sensitive to any signal. And that is called a central sensitization. So that is one of the other mechanisms of fibromyalgia. The diagnosis of fibromyalgia is always a challenge. It is based on the symptoms. Your physician, your Alleviate Pain Management doctors will ask you what are the different regions of the pain which are causing the symptoms, and will also assess the severity of that scale. And will also ask you about your fatigue, your depression, anxiety, concentration, etc. So based on the scores, it's a chart which we have, we'll be able to say whether you have fibromyalgia or not. Again, this is a diagnosis exclusion. We need to rule out any cause which is causing the symptoms also. So we'll also ask for an array of blood investigations, your vitamin B6, your B12, your thyroid, your ESR, your vitamin D levels, etc. all need to be optimized before we can say it's fibromyalgia. So it's also a diagnosis of exclusion. The treatment of fibromyalgia is always at Alleviate. What we offer is a very unique management, which also has been approved internationally. Multidisciplinary team approach and also interdisciplinary team approach. What that means is your patient, the patient that is you, will be at the center of our treatment, and you will have access at the same time to the pain physician, to the physiotherapist, to the nutritionist, the psychologist. All of us will be giving input to the fibromyalgia patient at the same time, and also we'll be discussing all the points with each other also. So you get different inputs from all the time. The mainstay of treatment of fibromyalgia is physical therapy. You need to optimize your activities and engage with the physiotherapy team, which will give you a nice aerobic exercise, a graded exercise program to build stamina, etc. Because what happens in fibromyalgia, there's a lot of pain and stiffness. So to overcome that, we'll give you a graded aerobic exercise therapy. The pain physician will also give you a bit of medications. There are currently a few drugs which have been FDA approved for fibromyalgia. So medication does play a big part also in a fibromyalgia treatment. The physiotherapist will also be teaching you how to do yoga, because relaxation technique is very important for the brain. We're also going to be encouraging you to do a bit of hydrotherapy, or encourage you to go for swimming, which is extremely useful. The psychologist will also teach you a bit of mindfulness techniques, cognitive behavior therapy, because we need you to feel relaxed as your day-to-day activities, because stress plays a very important part. The nutritionist will also be talking about how to optimize your nutrition, because our antioxidant nutrition is very important. We'll have to look at that also. So providing all this, and in terms of fibromyalgia patients at Alleviate Clinic, we also run a few IV infusions. There is some evidence where we can run some IV medications, etc. in a glucose bottle. We'll give you some lidocaine infusions or ketamine infusions, vitamin C, etc. just to calm your nerves down. So all these things are very important. There's not one thing which is more important than the other. And that is a true biopsychosocial approach, and the Alleviate way is a multidisciplinary team approach. Fibromyalgia patients have been suffering with pain. It's a silent pandemic. You've been suffering for many years, all investigations running to pillars to post, and everything is normal. But here at Alleviate, we do understand your condition, and by using a multidisciplinary team approach, what we look at is to improve your quality of life and your functionality. By focusing on these two, invariably your pain will also come down, and we'll cater to each and every patient in a unique way. So each patient is different. So we'll come up with a pain management program which is unique to you. So come down to Alleviate Pain Clinic if you suspect you have fibromyalgia, and you can see the difference what Alleviate way will make to your life.